Acid reflux, heartburn, chest burning and indigestion. If you've ever felt your chest burn after eating, you're not alone. Millions of Americans, especially between the ages of 30 to 60 plus, experience this problem daily. But why does your chest burn after eating? And most importantly, what can you do about it? Let's break it down step by step, just like a doctor would explain. Hello everyone, welcome back to our health channel. Today, we're diving deep into a very common health issue, chest burning after eating. You may have called it acid reflux, GERD, heartburn, or indigestion, but the feeling is often the same, a burning sensation in your chest, sometimes rising up into your throat, especially after meals. This topic is extremely important because many people ignore these symptoms, thinking it's just something they ate, but in reality, it can indicate underlying health problems. So, let's go A to Z with all the questions and answers that you might have in your mind. Q1. What exactly is chest burning after eating? Answer. Chest burning after eating, commonly known as heartburn, is a symptom that feels like a fire in your chest or throat. It happens when stomach acid flows back up into your esophagus, the tube that carries food from your mouth to your stomach. This backward movement of acid is called acid reflux. Q2. Why does chest burning happen mostly after meals? Answer. After eating, your stomach produces more acid to digest food. If the valve between your stomach and esophagus, the lower esophageal sphincter, is weak or relaxed, acid escapes upward. That's why symptoms are most common after meals, especially heavy, spicy or fatty meals. Q3. Is chest burning the same as a heart problem? Answer. No. Although it feels like it's near the heart, heartburn has nothing to do with your heart. It's caused by stomach acid. However, chest pain can sometimes be a sign of a heart attack. If your pain is severe, comes with sweating, dizziness, or shortness of breath, seek emergency help immediately. Q4. What foods commonly trigger chest burning? Answer. Foods that relax the esophageal valve or increase stomach acid are the main culprits. Examples include spicy foods, fatty or fried foods, citrus fruits like oranges, lemons, tomatoes and tomato-based sauces, chocolate coffee and caffeinated drinks, alcohol, carbonated sodas, peppermint. Q5. Does age make chest burning worse? Answer. Yes. As we age, especially after 30, 40 or 60 years old, the strength of the esophageal valve weakens, digestion slows down, and obesity or lifestyle habits add extra pressure on the stomach. That's why adults between 30 to 60 plus are more likely to complain about chest burning. Q6. What lifestyle habits can cause chest burning? Answer. Eating too quickly, overeating large meals, lying down immediately after eating, smoking, drinking alcohol, wearing tight clothing that squeezes the stomach, lack of exercise and obesity. Q7. Is chest burning always GERD? Answer. Not always. GERD, gastroesophageal reflux disease, is when acid reflux happens frequently, at least 2 times a week or more. If you only get mild symptoms once in a while, it may just be occasional acid reflux. Q8. What are the warning signs that chest burning is serious? Answer. Seek medical attention if you experience difficulty swallowing, chronic cough or hoarseness, burning sensation daily or weekly, regurgitation of food into the mouth, unexplained weight loss, chest pain spreading to the arm, neck or jaw. These may indicate GERD, ulcers, or even cardiac issues. Q9. What home remedies can help immediately? Answer. Drink a glass of cold water to wash down acid. Chew sugar-free gum to increase saliva, which neutralizes acid. Elevate your upper body if lying down. Avoid eating for at least 2 to 3 hours before bedtime. Q10. Which natural foods can reduce chest burning? Answer. Bananas, natural antacid effect, oatmeal, gentle and filling, ginger, anti-inflammatory, green vegetables, broccoli, spinach, kale, Yogurt, soothing effect, but only if not too fatty. Aloe vera juice calms irritation. And tell us in the comments, have you ever experienced chest burning after eating? What remedies worked for you? Q18, how do you know if it's acid reflux or a heart attack? Answer, acid reflux usually worsens after meals, improves with antacids, and comes with a burning feeling. A heart attack often feels like pressure, tightness, or heaviness, sometimes radiating to the arm or jaw. If in doubt, always call 911. Q19. What daily habits should you follow to prevent chest burning? Answer. Eat smaller, more frequent meals. Avoid late-night dinners. Stay upright for at least 2 to 3 hours after eating. Drink enough water. Wear loose clothing. Limit caffeine and alcohol. Q20. Final advice from the doctor. Chest burning after eating is common but not normal. If it happens occasionally, lifestyle changes can help. But if it's frequent, don't ignore it, because untreated GERD can damage your esophagus and lead to complications. Always consult your doctor for persistent symptoms. So, the next time your chest burns after eating, remember, it's not just about the food, but also about how and when you eat. By making small changes, you can enjoy your meals without the burn. Don't forget to turn on the notification bell so you never miss our new videos. Share this video with your family and friends, because good health is the best gift you can give them. And tell us in the comments, have you ever experienced chest burning after eating? What remedies worked for you? This video is for informational purposes only. Please consult your doctor before making any medical or dietary changes. Q11. Can drinking milk help? Answer. Milk may give short-term relief, but because it contains fat, it can later stimulate more acid production. Skim milk may help more than whole milk. Q12. What role does stress play in chest burning? Answer. Stress doesn't directly cause acid reflux, but it worsens the symptoms. When you're stressed, digestion slows, and your body produces more stomach acid. That's why stress management, deep breathing, meditation, yoga can reduce chest burning. Q13. What medical treatments are available? Answer. Doctors usually recommend antacids, Tums, Malox, for quick relief, H2 blockers, ranitidine, famotidine, reduce acid production PPIs, proton pump inhibitors, omeprazole, pantoprazole, long-term acid control. For chronic GERD, surgery may be considered. Q14. Can exercise help with chest burning? Answer. Yes. Moderate exercise like walking, yoga, or cycling helps digestion and reduces acid reflux. However, avoid intense workouts right after eating, as they can make reflux worse. Q15. What is the best sleeping position to prevent chest burning? Answer. Sleep on your left side, reduces acid reflux. Use an extra pillow or elevate the head of your bed by 6 to 8 inches. Avoid sleeping flat on your back right after meals. Q16. Does weight affect chest burning? Answer. Yes. Extra belly fat puts pressure on your stomach, forcing acid upwards. Even losing 5 to 10 pounds can make a big difference. Q17. Can smoking and alcohol really make it worse? Answer. Absolutely. Smoking weakens the esophageal valve, and alcohol increases acid production. Together, they double your risk of GERD.